Hey there, I'm Steve, and today we're diving into a topic that affects millions of lives, but often goes unnoticed. We're talking about mass incarceration in the United States. But this isn't just about crime and punishment, it's about a system bursting at the seams, overcrowded, underfunded, and spiraling into chaos. And we're paying the price, not just in dollars, but in lives that could have been saved if we made smarter choices. Hey, before we jump into this deep dive, make sure you subscribe to the channel, like this video, ring the notification bell so you don't miss out on more upcoming deep dives on important topics like this one. Hey, it really helps me out. I appreciate it and keeps you up to date with new content. And by the way, I've included a giant reference guide in the description below if you want to check out the facts or dive deeper into any of the things I'm going to talk about today. So be sure to check that out after the video. Now, let's get started. Let's talk about the bigger picture. Mass incarceration in America. Imagine a place where the doors never stop revolving. No matter how hard people try to leave, they're caught in a loop, back in the same cell, facing the same future, and that place is our prison system. The U.S. has less than 5% of the world's population, but holds about 20% of the world's prisoners. 1 in every 5 prisoners worldwide is in an American jail or prison. And here's the kicker. Most aren't in for violent crimes. Nonviolent offenses, especially drug-related crimes, make up a huge part of the prison population. This surge can be traced back to the war on drugs, which kicked off in the 1980s and led to long sentences even for minor infractions. And the result? A system focused on punishment over rehabilitation, with an overwhelming number of people stuck in that revolving door. Let's talk about racial disparities and systematic bias. Well, here's something we need to talk about: racial disparities in our justice system. When you look closely, the statistics paint a clear picture. African Americans are incarcerated at 5 times the rate of white Americans. And it's not because African Americans commit more crimes. In fact, the data shows that drug use is similar across racial lines, yet Black Americans are more likely to be arrested and sentenced. Now, this isn't just about crime, it's about a system that's been stacked against minority communities for decades. Racial profiling, over-policing in low-income neighborhoods, and discriminatory sentencing laws all contribute to this imbalance. And let's not forget about the economic factor. Low-income individuals are less likely to afford quality legal representation, which often leads to harsher sentences. Communities of color aren't just affected by over-policing, they're devastated by it. Families are torn apart, economic mobility grinds to a halt, and entire generations are left behind. It's not just individuals being punished, entire communities bear the burden. Now, let's talk about the lasting impact of the war on drugs. The war on drugs was supposed to make America safer. Instead, it turned our prison system into an assembly line for nonviolent offenders. Laws like the Anti-Drug Abuse Act of 1986 led to harsher penalties for crack cocaine, used more often in Black communities, than for powder cocaine, more common in white communities. Now, these policies resulted in long sentences that disproportionately impacted people of color. Even today, with some states legalizing or decriminalizing marijuana, thousands of people are still serving time for offenses that are no longer considered serious crimes. The war on drugs didn't curb addiction or make our streets safer. It filled our prisons, and we're still paying the price. Many of the people swept up in this wave of tough-on-crime policies are still stuck in the system with little hope of getting out. Let's talk about the impact on families and communities. When someone goes to prison, it's not just their life that's affected. The impact ripples out to their families and communities. More than 2.7 million children in the U.S. have a parent in prison, and studies show that having an incarcerated parent can increase the likelihood of those children ending up in the system themselves. But it's not just about the emotional toll. What about the economic impact on families? It's devastating. When the primary breadwinner is incarcerated, families are left to struggle with financial instability. And even when people are released, they often face discrimination in employment and housing, making it nearly impossible to reintegrate into society. This is where the cycle of poverty and crime feeds on itself. If we want to break the cycle, we need to think beyond just the individual offender. Families and communities need support too. Let's talk about the school to prison pipeline. This pipeline starts early, and for many kids, the road to prison begins in school. The school to prison pipeline is a real thing. Zero tolerance policies in schools have turned minor infractions into reasons to expel or suspend kids, especially kids of color. And the presence of school resource officers means that what used to be handled in the principal's office is now handled in the courtrooms. Students, especially those in minority communities, are often pushed out of school and into the criminal justice system for what should be minor disciplinary issues. Now, this not only increases the chance of these children entering the prison system later in life, but it also disrupts their education, which is one of the key tools in preventing crime. If we're serious about stopping mass incarceration, well, we need to start by keeping kids in school, providing support services, and making sure that schools are a place of learning and growth and not a fast track to prison. Let's talk about the employment crisis. Always hear about the need to create more local jobs, right? Well, here's the irony. Prisons are offering local jobs, but nobody wants them. Actually, this reminds me of a time back in college when I was the photo editor for my school paper. I was assigned to take photos at the local prison, and when I got there, the guards thought it would be funny to toss this nervous college kid into a cell with some prisoners. They were playing cards, and now at first, I'm thinking, great, I'm in real trouble. These guys were staring me down, but after a few tense minutes, one of them grinned, tossed me a card, and the next thing I knew, we were laughing and playing together. That human connection broke the tension. But here's the thing. For correctional officers, this tension, this stress, it's the daily life. You're dealing with dangerous situations every day, and the pay is low, around $15 an hour in many places, and to that mandatory overtime, because they're always short-staffed and you've got a recipe for burnout. Some states have a 50% turnover rate. So here's the big question. If locals don't want these jobs, how do you recruit more people without increasing the cost of incarceration per person, which already ranges from 30 to 60 grand a year? It's not an easy fix. So let's talk about the revolving door of recidivism. Here's a story. About a decade ago, I did a story on a prison program in Massachusetts that was trying to break the cycle. Their focus was on rehabilitation, giving prisoners the skills they needed to start fresh when they got out. I sat down with some of the prisoners, and what they shared with me was eye-opening. They told me prison had always been a revolving door for them. They'd commit a crime, get caught, go to jail, get released, go back to the community in the same environment they were in before. No new skills, no new opportunities, and it's easy to see why they'd end up right back in prison. But this program was different. It wasn't perfect, but it worked. The recidivism rate for participants was 80% lower than for those who didn't go through the program. Why? Well, because they were learning real skills. They were getting college degrees, GEDs, and vocational training, and it gave them a way out, a chance to work jobs outside of the communities that trapped them in the first place. And here's the catch. People generally want to punish prisoners, not rehabilitate them. Now, there's this mindset that if you do the crime, you should suffer for it. And unfortunately, this program was seen as an added expense, which makes it harder to sustain. But it shows us something important. Rehabilitation works when we just need to shift our focus. So what's the goal of our prison system? Here's the big question. What is the damn goal of the prison system? Are we just trying to punish people, or do we want to punish but also provide opportunities for a productive life afterward? It's a good question. We often call our prisons penitentiaries, but do you know where that word comes from? It's rooted in the idea of penitence, reflection, remorse, and spiritual growth. The earliest penitentiaries were designed to rehabilitate. The idea was that solitude and reflection could help people become better citizens. But somewhere along the way, we shifted to a system focused almost exclusively on punishment. It's about making people pay for their crimes, not preparing them for life afterward. If we want to break the cycle of recidivism, we have to decide what kind of system we want. Is it one that punishes people endlessly, or is it one that gives them the tools to change their lives? Now we've got the mental health crisis to worry about. Prisons are the new psychiatric hospitals. I mean, here's a critical piece of the puzzle. Mental health. Prisons have become the default mental health care providers in this country. Today, about 25% of inmates suffer from serious mental illnesses like schizophrenia or bipolar disorder. This reminds me of an experience from back in the late 1980s when I worked in the medical field in New York. I had to visit a state mental hospital for an eye care emergency, one of their patients. It was exactly what you'd imagine from the old books and movies, a giant facility with multiple wings, heavy doors, echoes, and staff everywhere. But here's the difference. Everyone in that hospital was trained to care for the mentally ill. Sure, it was far from perfect and the place was pretty depressing, but there was a structure there that focused on treatment. Now think about prisons today. Guards are not trained to handle mental health crises, and prisoners don't get the care that they need. People with mental illnesses often end up in solitary confinement, which only makes things worse. And we're not treating mental illness here, we're punishing it. So let's talk about the importance of mental health support on the policing front line. You need to think about this. Many people with mental health disorders are ending up in prison because police officers on the front line are not mental health professionals. They're trained for enforcement, not for care. And this is where we need mental health support at the policing level to redirect individuals into the right systems before they ever enter the prison pipeline. One example of a program that works well is the Crisis Assistance Helping Out on the Streets, or CAHOOTS, program in Eugene, Oregon, where a 911 call involves a mental health crisis. A mental health professional and a medic respond instead of a police officer. They're trained to de-escalate the situation and connect individuals to mental health services instead of jail. CAHOOTS handles nearly 20% of all 911 calls in Eugene and saves the city millions of dollars each year. But more importantly, it diverts people away from the prison system and toward the care they actually need. Programs like this free up the police to focus on real crimes while ensuring those in crisis get the appropriate care. So is it more expensive to house mentally ill inmates? Well, the simple answer is yes. It costs, again, between 30 to 60 grand a year to incarcerate someone, but the cost is even higher for inmates with mental health needs because they require more services. But here's the thing. Providing community-based mental health treatment is not only cheaper, it's also far more effective at reducing recidivism. Redirecting people with mental illnesses to treatment facilities instead of prisons would save lives and save money. Now, here's a different approach. Comparing the U.S. to other countries, let's see what we can learn. Let's look outside the U.S. and see how other countries do things. Take Norway, for example. Norway focuses on rehabilitation instead of punishment. Their prisons are designed to feel like normal life. Inmates have opportunities to learn skills, get an education, and even work regular jobs while they serve their time. And the result? Norway's recidivism rate is around 20%. Compare that to the 70% in the U.S., and while Norway spends about 93 grand per inmate annually, the long-term savings from recidivism being reduced makes their system more cost-effective. So why don't we adopt this approach in the U.S.? Well, there are a few reasons. First, we have cultural attitudes towards punishment. In the U.S., there's this deeply ingrained belief that if you commit a crime, you should suffer for it. And that makes it hard to shift toward a more rehabilitative approach. Then there's the private prison lobbying. Private prisons prison companies have a financial incentive to keep incarceration rates high. They lobby for tougher sentencing laws to keep their beds full. In countries like Norway, prisons are state-run and focused on rehabilitation, not profit. While investing in rehabilitation would save money in the long run, it would require upfront investment. Our system is already stretched thin, and adding more funding for education, job training, and therapy is seen as too expensive. Even though it could save us money in the long run, we won't do it. Now, we got the role of bail in mass incarceration. Another key factor we haven't touched on yet is the cash bail system. Here's how it works. If you are arrested and can't afford bail, you sit in jail until your trial. But wealthy individuals can pay their bail and go home, while poor individuals often remain incarcerated. This system disproportionately affects low-income individuals who may sit in jail for months or years without being convicted of a crime. And this isn't just about the inconvenience of being in jail. I mean, being incarcerated pre-trial means losing your job, falling behind on rent, and potentially losing the custody of your children. And as you can guess, people stuck in jail pre-trial are more likely to plead guilty just to get out, regardless of their actual guilt. Reforming the bail system is a critical step towards reducing mass incarceration. And we got the prison labor and exploitation problem. I mean, we can't talk about mass incarceration without addressing the issue of prison labor. Many prisoners work while they're incarcerated, but they earn pennies for each hour, far below minimum wage. I mean, this work often benefits large corporations that rely on cheap prison labor. And here's the ethical dilemma. Should incarcerated individuals work for fair wages? On the one hand, work programs can help inmates build skills and maintain a routine, which can be positive. But on the other hand, this system often exploits inmates for profit with little regard for their rehabilitation rights. We need to reform prison labor laws to ensure that inmates are treated fairly and that the work they do genuinely contributes to their rehabilitation, not just to corporate profits. So let's talk about the bigger picture. What needs to change? Well, it's clear we need to rethink how we handle incarceration in the U.S., especially for nonviolent offenders and people with mental health issues. Invest in mental health care? Well, we need more community-based mental health facilities. This will save money and provide the care that's currently lacking in prisons. We can reform sentencing laws, reducing mandatory minimum sentence for nonviolent crimes, and giving judges more discretion will help keep people out of prison when it's not necessary. We can address the staffing crisis. We need to increase pay, improve working conditions, and provide mental health support for correctional staff to reduce burnout and turnover. And we need to reform the bail system. No one should sit in jail just because they couldn't afford the bail. Bail reform will reduce unnecessary incarceration, especially for low-income individuals. And we should also reevaluate private prisons. We need to take a hard look at the role of private prisons. When profit is the priority, rehabilitation takes a back seat, and society pays the price. So, what can we do better? Well, mass incarceration, the staffing crisis, private prisons, and the mental health challenges in our prisons are all deeply connected. By investing in rehabilitation, mental health services, and criminal justice reform, we can start to fix a system that's failing on so many levels. Hey, if this topic resonates with you, let's keep the conversation going. Subscribe to the channel, like the video, ring the bells so you don't miss out on future discussions. And as always, I've included that giant reference guide for you in the video description so you can check the facts and dive deeper into this issue. Hey, here are some more videos that I think that you'll like. And until next time, stay safe, stay curious, and stay awesome. See ya!